India in Numbers, an in-depth look at the social, economic, healthcare, and education sectors in India. Disclaimer: this presentation is provided for educational and informational purposes only. The data is gathered from various external sources. Their inclusion does not constitute an endorsement of the original authors, their viewpoints, or their methodologies. The contents should not be construed as a criticism, negative evaluation, or disparagement of the government, any of its departments, ministries, and agencies, or officials, or residents of a state. The contents of this deck are based on data released by official agencies such as the Reserve Bank of India, World Bank, IMF, Government of India, Government of Indian States. Each slide will show the data source. There is a vast amount of data available on the internet, from government, NGOs, private organizations, etc. This presentation looks at a small subset of this data. It is meant to provide an overview, not a comprehensive analysis of the data. Every effort has been made to ensure the accuracy of the data presented. Any inadvertent errors or omissions are unintentional and will be corrected upon receipt of verified data from official sources. The audio has been generated using Google Text-to-Speech, TTS. The automated synthesis may result in occasional mispronunciations of specific regional names, technical terms, or Indian states. Your understanding is appreciated. The RBI Statistics Handbook provides data for all the states and union territories. For reasons of clarity and space, most of the charts in this presentation show the top 10 states and the bottom 10 states. In some charts, the data for India as a whole and other countries are shown as a comparative metric.
We start with healthcare indicators. This includes life expectancy, infant and maternal mortality, and healthcare infrastructure. The data for healthcare infrastructure includes the number of doctors and hospital beds per lakh population in rural areas. RBI has not released the healthcare infrastructure data for urban areas. We look at public health expenditure as a percentage of GDP, health insurance coverage, and disease burden. We conclude with some suggestions on how these metrics can be improved.
Kerala has the highest life expectancy of 75.1 years. Chhattisgarh has the lowest life expectancy of 64.6 years. The average life expectancy in India is 70.3 years. For all the states, the life expectancy for women is higher than that for men. Countries such as Japan, Switzerland, Singapore, and South Korea have a life expectancy of 83 years or more.
In 2023, Madhya Pradesh, Uttar Pradesh, and Chhattisgarh had the highest infant mortality rate of 37. Daman and Diu had the lowest at 0. Among the larger states, Kerala had an infant mortality rate of 5. Countries like Iceland, Slovenia, Singapore, and Japan have an infant mortality rate below 2.
In 2021-23, Odisha had the highest maternal mortality rate of 153. UP, MP, and Chhattisgarh had a rate between 145 and 150. Kerala and Andhra Pradesh had the lowest maternal mortality rate of 30. Norway has a rate below 2. Denmark and Poland have a rate below 3. This chart shows healthcare infrastructure data for rural areas. Odisha has the highest doctor shortage of 361. States not shown in the figure on the left have the required number of doctors. UP has the highest shortage of surgeons, specialists, pediatricians, and physicians of 2,780. RBI has not released this data for urban areas. Union territories like Ladakh, Andaman, and Nicobar had the highest number of doctors per capita. Among the states, Himachal Pradesh and Goa ranked high. The states with the lowest number of doctors per capita were Jharkhand and Uttar Pradesh. Each community health center must have a surgeon, physician, obstetrician, and a pediatrician. Only 17% of CHCs had them. The WHO recommends 2.5 health workers, doctors, nurses, and midwives, per 1,000 people. By comparison, Cuba has 9.5 doctors per 1,000 population. It has a life expectancy of 79.9 years, infant mortality rate of 4.1, and maternal mortality rate of 35.
In rural areas, Tamil Nadu, Uttar Pradesh, and West Bengal had the largest number of beds. In urban areas, West Bengal, Tamil Nadu, and Karnataka had the largest number of beds. Overall, TN, West Bengal, UP, and Karnataka had the largest number of beds. Each primary health center is required to have 4 to 6 beds. 73% had at least 4 beds.
This chart shows data from rural areas. Himachal Pradesh, Arunachal Pradesh, TN, Karnataka, and West Bengal had the highest number of beds per capita. Bihar, Maharashtra, Odisha, Chhattisgarh, and UP have the lowest number of beds per capita. Maharashtra, which is the largest contributor to the GNP, has a very low number of hospital beds per capita.
The Ayushman Bharat Pradhan Mantri Jan Arogya Yojana (ABPMJAY) is a Government of India initiative to provide healthcare insurance to all of its underprivileged citizens. PMJAY provides a health cover of Rs 5 lakhs per family per year for secondary and tertiary care hospitalization. It is designed for 12 crore poor and vulnerable families, approximately 55 crore beneficiaries who constitute the bottom 40% of the Indian population. Over 35 crore cards have been issued and 30,000 hospitals have been impaneled. There has been over 10.4 crore hospital admissions as of Sep 2025. This is the largest government-funded health insurance scheme in the world. The PMJAY scheme has been allocated Rs 9,406 crores in 2025-26.
The National Health Policy 2017 aims for universal health coverage by providing healthcare at 3 levels. Primary, through primary health centers and community health centers at the village and block levels. Secondary, district hospitals. Tertiary, specialized hospitals like AIMS. The Union budget estimate for 2025 to 26 shows the 11% increase over the previous fiscal year. States are responsible for the public health system, which includes hospitals and clinics. In 2021 to 22, 58% of healthcare expenditure was borne by the states.
The share of the allocation for the health ministry in the union budget has decreased from 2.5% in 2017-18 to an estimated 2% in 2025-26. India's public health spending is about 1.4% of GDP, which is lower than that of several developing countries. The center and states spent about 6% of their total expenditure on health. The comparable numbers are 7% for Brazil, 10% for China, and 17% for the UK. The PMJA scheme has been allocated 9,406 crores in 2025-26. As fertility rates decrease, especially in the southern states, the percentage of people above 60 is increasing. This requires allocation for geriatric care. In Sep 2024, PMJA was expanded to include all citizens above the age of 70. Disease burden. There is a high disparity in deaths due to communicable diseases between states. States like UP, MP, and Bihar show a higher death rate due to communicable diseases than states like Karnataka, Maharashtra, and Tamil Nadu. This is reflected in the lower life expectancy in UP, MP, and Bihar compared to the southern states. The share of non-communicable diseases, NCD, such as heart disease, COPD, diabetes, etc., has increased in India. Over the last 10 years, the share of NCD has increased from 58% to 68%. In the same period, communicable, maternal, and neonatal deaths have reduced from 32% to 22%. NCDs are now responsible for about 65% of all deaths in India. Cardiovascular diseases, CVDs, 27 to 28% of total NCD mortality, including heart attacks and strokes. Chronic respiratory diseases, about 11 to 12% of deaths. Cancer, about 9 to 10% of deaths. Diabetes, about 3 to 4% of deaths. ICMR INDIAB study, over 101 million people in India are living with diabetes, 136 million categorized as pre-diabetic. Hypertension, approximately 1 in 4 adults in India has high blood pressure. The Government of India has established the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke to address this problem. Deaths due to non-communicable diseases has increased from 58% in 2014 to 68% in 2024. The increase has been attributed to lifestyle changes, consumption of high sugar and high carbohydrate processed foods, and a sedentary lifestyle. Deaths due to communicable, maternal, and neonatal causes has decreased from 32% to 22% in the same period. Access to healthcare has decreased this rate, though some states in Central and North India continue to have higher communicable deaths. Cardiovascular deaths contributed to 28% of NCD. Respiratory deaths contributed 12% of NCD. Cancer contributed 10% of NCD. Diabetes contributed 4% of NCD. India has made tremendous progress in improving the health of its citizens in the last 50 years. Life expectancy has increased from about 50 years to about 70 years. Maternal mortality rate has decreased from about 600 to less than 100. Infant mortality rate has decreased from about 140 to about 26. India's infant mortality rate of 24 to 26 is slightly better than the global average of 27. If the high IMR rate of 37 is reduced in states like UP, MP, and Chhattisgarh, India's IMR rate can go down even further. India's maternal mortality rate of 95 to 102 is much lower than the global average of about 220. States like Odisha, UP, MP, and Chhattisgarh have a much higher MMR of 145 to 150. Reducing this rate will decrease India's MMR. The increase in deaths due to non-communicable diseases, about 68% of all deaths, is a cause for concern. The primary reasons for the increase in NCDs: changes in diet, high carbohydrate, high sugar, high salt, high trans fat foods, sedentary lifestyle in urban areas, increase in use of automobiles and two-wheelers, air pollution. India has some of the most polluted cities in the world. In 2025, Delhi did not have a single good air day. Tobacco and alcohol consumption, leading to cancer, COPD, cirrhosis of the liver, etc. High levels of visceral fat. Each of this must be addressed with public outreach, stricter food safety standards, and enforcement.